You're watching Good Day Kentucky with Lee Cruz, Haley Harmon, Doug High, and your forecast with meteorologist Dylan Godet. ABC 36 on your side.
Everybody, welcome back. We are talking kids with Dr. Caitlin this morning, as always, with Lexington pediatrician Dr. Caitlin Innings.
Now, today we're talking about a skin condition that can affect kids.
It's got a very long name, and we're not going to attempt to say it. You're the doctor.
Yeah.
We're going to let you say it.
I always think it sounds like a Harry Potter spell, so it's
yes.
molluscum contagiosum. Like you wave your wand, and then now you have words.
Yes, excellent,
Yeah.
excellent.
Yeah. So,
Okay, so what is this?
yeah, so this is a pretty common. You know, the layman's term for it used to be water warts because a lot of kids will pick it up in the summertime when they're around swimming pools. The contagiosum part is, you know, it is technically contagious, not necessarily just to the touch, but if it gets scratched and then you like are able to touch someone else, sort of like the hand, foot, and mouth we talked about a couple weeks ago. But essentially, it starts out as just like these little tiny kind of flesh-colored bumps. The molluscum part is like a mollusk, like what grows on the bottom of a whale, you know? And they kind of have like these little belly buttons to them. And so it'll start out usually just as a couple lesions. Kids who have eczema or sort of compromised skin barrier anyway are more susceptible to it just because they do more scratching and then they can kind of spread it.
Okay.
But it is picked up through contact. It can be picked up through sharing towels, sharing pool toys, sharing, you know, anything like that. So a lot of kids will pick it up in the summertime. The duration of it can vary. Usually about 6 months later, it's kind of burned out and gone away, but I have seen kids hold on to it for a couple of years before it will really completely resolve, and it just kind of depends on the kid.
So
Is there a treatment for it, or is it just kind of you wait?
Usually we don't recommend treating it because it is benign, and treating it can cause scarring. So it's in the family of viruses called pox viruses, so think smallpox, monkeypox, and we know that those lesions, once if you were to pick at it, or because that can be a treatment, you can lance it, you can freeze it, just like a regular wart. You can do bug juice on it and make it blister and go away, but you're replacing like a flesh-colored bump that eventually will resolve on its own with like a little pock mark, right? It'll leave like a little scar.
Oh, okay.
So unless it's widespread, unless it's in like areas like the genitals where we really like want it to go away, we don't routinely recommend treating it. If it gets really widespread or it's on the face or on the genitals, we'll usually recommend seeing a dermatologist to discuss treatment options.
Okay, so let's say there's a parent out there and their child gets it, or they think has it for the first time maybe this year, because lots of kids at water activities. What's their course of action? What should they do?
So like I said, it is contagious. There's some debate as to can it be passed through swimming pools. They don't think it can. They really think it is more direct contact. So trying to keep it covered with like a watertight bandage if they're going to be at the pool to prevent spreading it to others. Trying not to, you know, share baths with siblings while they have it so they don't spread it to other kids in the home. And then really stressing to the kid, don't pick at it, right? Because if you're picking at it, you can spread it other places, you can spread it to other people, and there's that risk for it getting sort of infected with bacteria that just kind of live on the skin. So, you know, usually we say leave it alone. If it's looking red or infected, you need to bring them back in for us to like make sure we don't need to do some sort of topical antibiotic or something. But
and how pervasive is it? I mean, are parents really need to be aware of this, or
it's pretty common. I mean, I kind of say, I joke it's kind of like the chicken pox of this generation, because they don't really get chicken pox anymore because they're vaccinated. Right. You know, I don't ever remember this when I was younger, people having it, but maybe it just wasn't that noticeable.
But most of your patients have a mild case.
Yeah, most kids will get it somewhere between ages 1 to 10. They'll get like a mild case, and then it'll resolve, and then they're kind of good.
Okay.
Yeah.
Well, something to know. Keep it in mind this summer. Yeah, lots of water play. All right, Dr. Caitlin, good to see you. Thank you so much.
Absolutely.
Stay with us. Back with more in just a moment.